Dear all, today let's see about what is IV flow rate. It's a very important topic for nurses and nursing students. So, what is this IV flow rate? It's the speed at which the IV fluid is infused into the patient's vein. Doctors generally prescribe patient has to get 2000 ml over 8 hours. So, how do we know whether 2000 ml of fluid is going over 8 hours? It should not get over by 7 hours or 6 hours. This 2000 should be calculated equally, that it has to get completed over 8 hours. So that is the rule. If it finishes before, it can lead to fluid volume excess, which is not good for the patient's body. So it is very important for nursing students and nurses to know about the calculation of IV flow rate. This IV flow rate is calculated in two ways. One is drops per minute when we use the intravenous infusion set. Next is milliliters per hour when we use the infusion pump. So first, formula 1. Flow rate, GTTS refers to drops. So flow rate is equal to total volume in ml into drop factor, which is calculated in GTTS per ml divided by time in minutes. So total volume, what's the meaning of total volume? It's the amount of IV fluid to be given to the patient. For example, 1000 ml or 2000 ml. Next, what is drop factor? It is the number of drops per ml. So there are different types of infusion set. We have the IV infusion set, we have the pediatric infusion set, we have the blood infusion set. So for a macro drip set, which is used for administering IV fluids for an adult patient, the usual drop factor is 10, 15 or 20 drops per ml. Now, in order to make sure what is the exact drop factor, we have to check the label of the IV infusion set, where they will clearly tell us whether it is 10 or 15 or 20. Next is a micro drip set, which is a pediatric infusion set. So here the hole is very small, so 60 drops makes 1 ml. Next is time. Time should be calculated using minutes. Suppose if it is 1 hour, we can't calculate using 1. It should be converted into minutes. For example, 1 into 60, 60 minutes. Now let's see an example how to apply this formula. Suppose if doctor has ordered 1000 ml of normal saline needs to be infused over 8 hours, and here the drop factor of the IV set is 15 drops per ml. Now let's apply the formula. Flow rate is equal to total volume in ml. So here the total volume is 1000 into drop factor. Now what is the drop factor here for this infusion set? It is 15. So 1000 into 15, and this has to be infused over 8 hours. So this hours needs to be converted into minutes. So 8 into 60. So it comes 1000 into 50. We get 15,000. 8 into 60 is 480. So 15,000 divided by 480. The answer is 31.25. So when we connect the IV fluid, we have to make sure, look at our watch and check whether 31 drops is going in 1 minute time. So if we make sure that patient is getting only 31 drops per minute, then as per the doctor's advice, 1000 ml of NS can be administered over 8 hours. So the set IV flow rate is 31 drops per minute.